Hi guys, ¿cómo está, amigos? We are here in hemodialysis. Okay, so we are going to start off with the process. What is the process that is involved? So you can see there is blood is removed for dialysis from your blood, right, from your artery. Yeah? Then it goes through the first pressure monitor, which is your arterial pressure monitor. Okay. Then after that, for them to increase the flow, it goes through a blood pump. Okay. Then remember always that this blood actually we add heparin to prevent any clotting. Then it goes into the next monitor, which is your dialyzer inflow pressure monitor. Okay. Then finally it reaches the dialyzer, which has your dialysate. Okay. Remember your artificial solution that mimics your plasma. Okay. Then after the filtration has happened, then it goes out into the third monitor, which is your venous pressure monitor. And finally, before it enters the blood, which is your venous, it actually has to remove any air that is in the blood to prevent any obvious embolies. Then finally, it's returned to the blood. So how frequent do we do dialysis? So it depends on the schedule that the patient is on. There are three main schedules. Actually, there are only two main, but there's an additional third. Okay. The first one is continuous. When you are continuously doing, especially for ICU patients, you can do continuous dialysis. Number two, it can be by intermittent means, which is perhaps the most common one. Okay, you can do it 3 times a week depending on whatever the patient needs. And finally, there's what called sustained low efficiency. There are 3 main access that you can give dialysis essentially because you need to remove blood from the body. It's either you do a catheter or you do what you call an arteriovenous fistula, and finally you can do an implantable graft. Now, starting off with the catheter. Okay, so the catheter central, it can either be 2 ways. Okay, it's either a central catheter, which means it goes through a subclavian or a jugular vein for temporary access, or you can do a tunneled catheter, which is just placed just under the skin to prevent any risk of infection, and it typically lasts for 6 months. Moving on to our arteriovenous fistula. Remember, a fistula is an abnormal communication between 2 epithelial-lined tissues. Okay, so you do an arterial to venous fistula. This will be the best access. Okay, and always remember the things that you need to remember is that if there's an audible bruit over that fistula, it indicates that the fistula is patent. And finally, we have a graft. Okay, typically it's lined by what you call polytetrafluoroethylene. Apart from the long-term central venous catheterization, the insertion of an AV graft remains the only option to allow continuous hemodialysis when the patient's superficial veins have been exhausted. So the good thing about hemodialysis as opposed to things like peritoneal dialysis is that it is way more efficient because of the higher rates. Remember, the whole process is very fast, and so it will be useful, for example, if the patient needs acute dialysis for all those 5 indications that we have mentioned for acute dialysis, then it will be useful to use hemodialysis as opposed to peritoneal dialysis. But the downside though is that it is way less physiological. Okay, remember the kidney and the dialyzer it's not a physiological process, and so you risk having hypotension or something like hyposmolarity, and the fact that it requires vascular access.